You've just been told that you need surgery, and you've met with the surgeon and he's told you that there are some risks associated with the surgery. He then hands you a 3-page document that tells you that basically this surgery could cause every complication under the sun. Of course, you need the surgery, so you sign it. After the surgery, you suffer a significant and severe post-operative complication. Is your surgeon responsible if he did not give you informed consent? Would you like to learn more information? Then follow along for the next few minutes while I explain to you the law of informed consent in Ohio. My name is Stuart Scott. I'm a medical malpractice trial attorney in Ohio. Every patient is entitled to be told the risks and benefits of their surgery. And not just to the hypothetical person, they're entitled to know the specific risks that apply to them. Some people, before they have surgery, may have other conditions such as hypertension or a previous history of blood clots or heart disease. These are specific risks that need to be evaluated and considered by your doctor. And if your surgeon doesn't truly understand what the risks are for you, then he needs to refer you out to another doctor, usually your family internist or specialist such as a cardiologist. Your surgeon needs to explain to you more than simply the risks or potential side effects of the surgery. He or she also needs to explain to you the other options available, even if these are not his or her recommendations. Every patient is entitled to know what the reasonable options are, either to protect them against potential injury or alternatives altogether to the surgery. A doctor cannot withhold this information simply because that's not the way they do the surgery or because it might mean that you would go elsewhere for your treatment. Now, when a patient sues for lack of informed consent, he or she will need to prove that the doctor did not provide them the specific information about the risks and benefits of the surgery for them, or that he failed to provide alternatives that a reasonable person might have chosen in lieu of the options presented by that doctor. Another question that people frequently ask is, will I need an expert to support my case? And the answer is yes. You will need a doctor to explain to the jury what the reasonable and likely risks are, as well as what the reasonable alternatives are. You may have questions about your medical care and whether you received informed consent. If you do, give me a call. We're here to answer your questions. We answer these types of questions every day.